Well, thank you everybody for joining us today on the Zoom In with Daniel Root. This is Tuesday, the 24th, I believe. Yep. And September 24th. So we're going to go ahead and get this Zoom In started. And I'm going to quickly go through a presentation. I see with the statistics that are coming out now that we have a huge problem with toxicity in the world. So I'm going to go ahead and flip through this screen or this slide deck. So the alarming health statistics have just recently been made aware to me, frankly. I don't know how long these have been out, but they look very recent. But 74% of American adults are overweight or obese, and close to 50% of children are overweight or obese. And 77% of young adults are unfit for military service due to obesity. That's pretty amazing. And then 50% of American adults have prediabetes or type 2 diabetes. And then 30% of teens now have prediabetes too. So the rising disease rates corresponding to those, 18% of teens have fatty liver disease, which is a condition only seen in late stage alcoholics. And then young adult cancers are up by 79%. Now, in 2024, there's going to be over 2 million cancer cases. That's just unheard of. And then 40% of 18-year-olds have a mental health diagnosis. Even that's just insane. So 25% of American women are on antidepressants. The autism rates are just obscene too. They are, the national average is 1 in 36 children. I think it was like 1 in 1,500 just in 2020. So 1 in 36, horrible. And of course, in California where I live, 1 in 22 children have autism, and we do live in a state that is the most toxic for air and water, and actually the soil too. So infertility and metabolic dysfunction. Infertility is increasing 1% per year, and sperm counts have decreased by 1% per year since the 1970s. And 26% of women now have polycystic ovarian syndrome, or PCOS. And the US has the highest infant and maternal mortality rates in the developed world. That's just unreal. But what's driving this, of course, is what's called metabolic dysfunction, which is caused by the toxic food system and environmental toxicants. But the rise in the toxins in food, water, and air is the silent driver of these alarming health statistics. So why is it essential? Because detoxination helps remove toxins stored in the body that contribute to obesity, metabolic dysfunction, and other chronic conditions. And by eliminating these fat store toxins, we can then reverse metabolic disorders, improve mental health and clarity and energy, and reduce the risk of cancers and autoimmune diseases. So I want to just bring these statistics up in case these are a topic for questions or conversation today in this fireside chat. So I'm going to stop the share and let you guys throw out questions or just, basically if you have any topics you want to talk about, let's open up the floor here.
Daniel?
Yes.
Since my time is so limited today, if I could start with a question just to at least get one in. Thank you. And hi, everybody. So in recent years, I have become a histamine overload. And so niacin is not an option for me, and some other vitamin Bs as well. I can't recall now off the top of my head, but definitely niacin is a no-go. So how can I'm also like philosophically a believer in it doesn't have to be all or nothing. So how can I make the program work best given the circumstances?
So it is unfortunate that you're having a high histamine issue. Have you heard about vitamin C's role in being a histamine destroyer and used to actually treat MCAS or mast cell activation syndrome?
Yes, I'm taking quercetin, higher doses of vitamin C, vitamin D3, NAC, a multivitamin for women over 50, multivitamin mineral supplement, calcium. I am doing your CalMag presently.
Okay.
I think that's everything I'm taking. So yes.
Okay, yeah. If the vitamin C in high doses is not improving your histamine response, and niacin is absolutely out of the question, then I would say the only option you really have, because the only way to trigger rebound lipolysis, which is the main action that niacin induces that we need for this program, you're never going to be able to do that without niacin. So that's out of the question. But there is something else you can do, and it's not something I would recommend for everybody. But there is an amino acid that is L-arginine. Are you familiar with that? Yeah, it's one of the several types of or things that you can take that will increase vasodilation. So if anything, you can mimic the niacin flush sauna detox, which is the one that I wrote for firefighters. That
Mhm.
is something that can be done every other day or 3 times a week, whatever you want to do. But it's going to cause a vasodilation, and that will at least mobilize the bloodborne toxins out to the dermal regions where you can then sweat them out in the sauna. For now, that is probably the only thing that's going to be of any kind of value. It does, increase the benefit of sauna, uh,
Mhm.
but it's definitely never going to be as powerful as niacin. And just
Mhm.
so you know, you would take the L-arginine about 30 minutes prior to the sauna. And in
30
fact,
minutes.
yeah, and in fact, if you do that and then exercise for 20 to 30 minutes,
Mhm.
that'll just boost the output even better for both mobilizing toxins, and also it initiates the sweating.
Mhm. Can you please spell that?
Yeah, I think I can. L-arginine.
Thank you.
Yeah, you find it okay? Okay, great. Do you have any other questions before you have to go?
Plenty, but I don't want to occupy more space.
Okay,
So,
just
Well,
making sure
I'm
because I
really
need
glad
to.
you brought up the histamine question because I've sort of been coming to the impression that I'm also a bit histamine sensitive. It's a little bit inconclusive in my case, so kind of hard to nail down. But I did see the information in the book and the update about niacin being a histamine trigger, and so now my kind of senses, if you will, are tingling on that, so to speak. So I'll be looking for out for that. Um, when I take niacin, I don't know whether I'm having a particular like histamine reaction or not. I just sort of feel like, the typical niacin effects. So I wonder if I could ask you if I could, what how have you identified niacin as a particular concern because of its effect on histamine? I'm sort of planning on just toughing it out to get the benefit, but I'm wondering if there's something I should be aware of or look out for that might tell me I'm I don't want to say doing more harm than good, but it might not be worth it. I'm just assuming it'll be worth it. If you get my meaning on this.
Mhm. Yeah, so firstly, Dr. Abram Hoffer was basically treating MCAS with high doses of vitamin C and then introducing the niacin as a histamine, you know, trigger. And that actually is a way to deal with it, is to take vitamin C before you do niacin and allow that to get into the system so that it can be there to help clean up, if you will, the histamines. If you're really histamine intolerant and niacin causes hives, there's your sign. So hives are going to be the thing that will really tell you if you have a problem with it. So you're not having
Yeah.
problems.
Nothing like that. So but that's a really good tip to take the C. I know C is a big part of the protocol.
Mhm.
Um, but I've been filling out my sheet to figure out when to do what. That's a great sheet, by the way. That's a huge benefit and update on the PDF. So I'm going through that. So I'll add that to take the C before. I'm planning on doing the protocol sort of the way you suggest. Is first thing in the morning, start with the niacin while I'm still kind of dozing and before I started my day. So I'm wondering if I can just take the C, dissolved in the same water. I use powdered niacin. Um, I just dissolved in water. A plant, I could just dissolve some vitamin C crystals in there as well. Do you think it needs to be substantially before or sort of simultaneously could work?
Well, it would be better to have it before, but honestly, if you mixed it with the niacin powder, you'd be fine. They don't interact negatively, so you can definitely do that.
For now, it dissolves well enough. I just have to shake it and kind of wait.
Right.
Um,
You know, niacin
but
is more
yeah.
oily based, and that's why when I was doing powders, I wasn't terribly thrilled with it either because of the fact that it usually just like sat on top of the water and would not really dissolve in. But I'll tell you the reason I really switched back over to capsules because you have the first edition of the book, and I was promoting the powder back then, and that was prior to us being able to resell the supply kit. So
Hmm.
I was basically buying everything from like Amazon. The powdered form was what I was using, and the truth be told was that I had meant to give myself a 50 milligram dose because it had been at least a week since I'd had any niacin, and I missed that decimal point on the gram scale and gave myself 500 milligrams, and my stomach was not prepared for that. So I was writhing on the floor in that room back
Yeah.
there with the saunas.
Wow.
In pain, my stomach knotted up, but it was something I knew what I did wrong, and I just wrote out the flush and
Yeah. Is that the
everything.
main reason that you're not as much a fan of powder now? It's just for dosing practicality reasons?
Well, I thought it would be easier for people to be able to get exact doses with that, but it
Yeah.
actually turned out not to work. And then, of course, we were able to resell the kit, and the kit does come with 100, 500, and 1,000 milligram values of the niacin. And I
Right.
like that a lot better because you can accurately dose what you need. And also, when somebody's starting out with niacin, they've never done it before, and if they weigh like less than 150, for example, I would tell them to start with 50 milligrams. And it's real easy to just take the capsule and twist it apart and take whichever
Okay.
side has the most in it.
Yeah, I'm not new to this, but just like you said, I apologize if there's some noise here. Uh, I'm not new to this, but I am new to being very, very rigorous about the protocol. And I caught you in a couple of podcasts, and you reiterate, don't dabble. I was one of those dabblers. I mean, I tried to be, serious about it, but I didn't do everything exactly right. So now I'm trying to do it exactly as laid out, and I've understood it a lot better. But a couple of questions have come up in the meantime as a result of that. So when I've done detoxes in the past, I've been a big believer in the Zeolite, the particular product you recommend, and it comes in a couple of different sizes. And I've got both sizes. I forget whether it's like sub 3 nanometer, and then there's a larger one that's 20 or something like that. So I'm using both of those, and I get a really strong detox effect from that. Anyway, I like how you laid out when to use what, including the charcoal. But there's three things that I have used, or four things I've used in the past that aren't anywhere in your protocol, and I'm curious about your take on these guys. I'm not using any of the DSPM or the various chelators. Stopped using those, and I know you've talked about the challenges of those. But sodium alginate, chlorella, citrus pectin, and cilantro. So these are favorites in the detoxing, especially for heavy metals and various detox protocols. And I've heard people say you have to be really careful with cilantro, powdered cilantro in this case, because it can really stir things up. And if you don't have the ability to bind enough of that, you're not doing a protocol that has you binding that, you can make things worse. And citrus pectin is a favorite, especially of Wendy Meyer. She has a product that's citrus pectin, cilantro, and I think sodium alginate, or maybe I think I pulled sodium alginate from somewhere else, and chlorella. So I kind of dumped four of these on you. I'm really curious about all four of those, why they're not part of the protocol, if they could be added to the protocol. I know you don't want to put everything in the kitchen sink into the protocol. There's only so many things you can expect people to do. Any thoughts?
So yeah, in fact, that's one of the main things is actually the fact that this protocol does have a lot of moving parts, and adding more to it is going to really make people turn away from it. I'm surprised you didn't throw bentonite clay in there, by the way.
I'm sorry. I actually, so because of the zeolite, I figured that's bentonite clay on steroids. I sort of figured that's got that covered. Plus, I mean, I don't want to get too constipated. So the charcoal is an issue there
Yeah,
too. And the
exactly.
clay has been a problem. What I do with the clay in the bathtub is I'll make a paste and just apply it liberally all over.
Right.
You
Well,
know,
going back to like the modified citrus pectin and chlorella or spirulina and all these others, they really are not strong enough to bind and carry stuff out of the body. They are popular ones, I know, but the thing is that we're really trying to get lipophilic xenobiotics out of the body before they have a chance to reabsorb into the system. So the reason that I use the Hyaltrophin brand and at the 3x TMA or tribomechanical activation micronized zeolite is because the micron sizes are 0.32 to 1.36, and they are going to stay within the GI tract where we need them. So anybody who sells these nano zeolites and they claim they get into the cells and all that, that may be true. But what's more important is, in fact, because of rebound lipolysis, we don't care. The toxins are coming out of the cells. Where we need the binders to be is in the GI tract, and especially zeolite, because of its ability to do adsorption, absorption, and ion exchange, which kind of go with the absorption side. But adsorption is where the toxins cling to the outer surfaces. The absorption and ion exchange draws positively charged particles or poisons into the negatively charged cages. And the fact that it does that is kind of unique to binders. There's one other one that does that, and that is the green French clays. Good luck finding a good source for that in this country, by the way. But so zeolite is more popular and something that is actually I prefer myself. But the GI tract, the reason I keep it coated throughout a 30-day program like this, and you're going to do it 3 to 5 times per day on our program, is because those toxins that the liver cannot break down into water-soluble derivatives to be excreted through feces or urine are going to be picked up by the bile acids in the liver and then recirculated, enterohepatic recirculation, into the small intestine. And having zeolite there will prevent those toxins from reabsorbing. It'll clean the bile acids, which is actually helping to clean the liver, and it's making sure that they go out through the feces rather than reabsorbing. Also, the villi in the small intestine, where your food is actually, or the nutrients from the food is absorbed into the bloodstream, those villi, little finger-like protrusions on the walls of the small intestine, are shown in studies to be improved when you have zeolite. And the zeolite's capable of even filtering or chelating blood passing through the villi. So it's so powerful that I would rather people focus on the good binders. And if you want to add in, any of these other ones, you can. But there's one other thing to point out. Certain binders have different affinities for different things.
right.
So I would only use bentonite clay now if somebody mentions they have mold toxicity and they're dealing with mycotoxins. It's going to be more powerful for that. Enteros gel as well for biotoxins. So there's other binders that I would recommend, but it's kind of based on what's the toxicity.
One of the things about charcoal is when you take it in combination with things, I always wonder about, I don't want to take it at the same time as any vitamins or anything where I'm trying to get nutritive value out of it. And this is one of these gray areas. It's really hard to tell from various detox protocols. It's one thing I really like about your protocol is, a lot of time and effort over the years have gone into this, and sequencing matters. And a lot of times that's not that much emphasis is put onto that. I think a lot of times because people just don't know, even when they're making a protocol, they don't know. And so my question is, I don't think you would want to take charcoal at the same time as you're taking your other supplements,
That is correct.
or maybe the oil. I'm not sure. Any thoughts about that?
Yep. In fact, that's why we want you to take the oils less than an evening primrose oil, which, by the way, in the first edition of the book, I wasn't even promoting the EPO because I was still under the false information that's actually out there about the omega-6s versus omega-3s. So I'll just throw it
Right.
out there that that ratio is flipped. In our
Right.
protocol, you want more omega-6s, and that's because the cells of the body, every cell requires the essential fatty acid of omega-6s. So when we do our program, in the first edition of the book, for example, I wasn't really stressing the evening primrose oil unless you were having trouble digesting the oils. And that's one of the things that has now switched in our most updated protocol guidebook. But as far as like activated charcoal goes, yes, I am on the side right now of how bad the activated charcoal is with especially minerals. Now, I will tell you that I do have research that shows that that's not true, but I'm going to stay on the side of activated charcoal is going to pick up minerals, because I think the conventional wisdom out there is that it's not safe to take long term, and I agree with that. So on a 30-day program, taking it once a day, every day is not a problem. But doing activated charcoal, let's say for a year, I think is not a good idea. Some people would say that about zeolite, but I do disagree with that. Anyway, the beauty of zeolite in the case of minerals or any kind of nutrient absorption is that actually it improves the nutrient absorption.
Hmm.
The test subjects, like the test animals, have been fed zeolite with their food. And so when they did the studies with a control group, the actual study group always had higher nutrient densities than the control group. So, and that makes sense because during an ion exchange, it's going to release the minerals that it already contains. So it's already got calcium, magnesium, sodium, chloride, zinc, everything under the sun included. So as part of an ion exchange where it has a higher affinity for higher atomic weighted elements, it's going to release these good minerals, but it never releases the heavy metals as much as some people like to argue. I mean, you have to heat up your body to 752 degrees Fahrenheit or 400 degrees Celsius in order for that to happen. So you'd have bigger problems. But anyway, the activated charcoal is something that you definitely don't take around oils. So we space out the oils, the lecithin and the evening primrose oil away from activated charcoal by at least, I mean, I'm talking minimum of 30 minutes. But as far as the timing goes in the illustration that you'll find in the protocol guidebook, I have it at like basically after the first hour of ingesting niacin. So you have at least an hour and a half before you're going to be doing exercise, or excuse me, before you actually get to the sauna. And one other thing I want to point out about the protocol guidebook's illustration and a lot of the things that I've written about with the protocol, where I talk about take the niacin 2.5 hours before exercise and all that, those are minimums. So keep this in mind that you can actually stretch out the timing of various things. So in fact, you can really literally take the niacin and get delayed, like you got to go to the store or something, by as much as 5 hours before you have to start the exercise. So rebound lipolysis, it takes about 6 hours for it to come back down to baseline. And during that time, you're at an elevated state of liberating toxins from the fat. It peaks at 3 times normal levels, but comes back down. So you can literally wait more time than I allot. So you've got time to do other things before you actually have to start the exercise.
Yeah, the chart is really helpful because it shows you how long you're elevated with those lipids. Probably myself, like most people, I'm looking to get this all done and just come back to time frame in the morning and then get on with the rest of my days as possible. And then I'll be sipping zeolite water for the rest of the day is usually how I do it. It's powerful stuff. If I stop drinking it, then I get the headaches and everything. Yeah, of course, what everybody wants is they want to see some evidence that they've had success. We
Yeah,
want
it is it's a totally subjective thing for most people. The people that I work with as a remote detox coach, especially the ones in my Facebook group. And by the way, a lot of people in my Facebook group are there because of iatrogenesis, conditions caused by the medical interventions or diagnostics. and they're suffering, and the best way to know that they're getting a detox is how they feel afterwards. And again, this is also something that needs to be stressed, that our protocols the studies that we've done have always shown a 1/3 body burden reduction in a 30-day program. So most people do need to do this program more than once, and don't expect to feel any better during it. You're going to be in a heightened state of sympathetic mode. So it's a case of people are going to, not feel like they're getting any better during the program, but it's usually afterwards. So does anybody want to unmute and chime in?
Hey Dan, I'm Melinda. I'm from Australia, and
Thanks
sorry
for
I
joining
don't
us.
have my camera on because it is 22 past 4 in the morning on Wednesday morning. So
Well,
I'm currently lying in.
I get up at 4 in the morning, so I'm okay with that.
Well, I'm still lying in bed. I will get up afterwards, but I'm lying in bed in the dark. So
Okay.
anyway, yeah, just wanting to introduce myself because I'm going to be doing your protocol. I've taken some annual leave in November. I will still need to do it partly while I'm working, but I will be doing. I've got a couple of weeks annual leave to be able to concentrate on doing it. So just learning at the moment. Yesterday I downloaded a lot of the files off your Facebook group, and proceeding through reading those, and I will book your one-on-one free call to have a chat independently. But I also was listening to one of your Zoom-ins from last week, the 19th, I think it was, and you commented about emailing you. I was just curious if you're willing to give out your email address, or do you just contact you through the contact us on your website? Is that
Yeah,
the best way to?
actually, the setting up the complimentary consultation is something that would be the best thing to do, because you'll get my email address with the confirmation. But as far as my email goes, it's real simple. If you know, getdetoxinated.com, I'm just Dan at getdetoxinated.com. But scheduling that complimentary consultation allows me to learn more about your case and find out if this protocol would be appropriate for you, or if there's any contraindications or preclusions. So definitely, it's a good first start. And I really do enjoy meeting people and doing these complimentary consultations. I want people to really be able to get the most from this program that they possibly can, because it's new to you guys, but we've been doing this since 1982. So what's that, 42 years or so? So we've been really at this for a long time, but it was always in an occupational medicine setting or drug addiction rehab. So when I brought this to the public in 2019 with the publication of the book, what happens the next? We get COVID, lockdowns and things like that. So I just really want people to be aware of the program. I want to share as much as I can with you guys. That's why I do these Zoom-in calls. And so the first step would be the best thing is, or what would be the best thing would be to do the complimentary consult.
I intend one of the forms I saw yesterday had a bit of a case history of your past history. So I thought, oh, that would be probably handy to do before the call, and also to have read as much as I can beforehand. Curious though, what your thoughts are on fulvic and humic acids as binders.
Well, I've actually when we started off working with binders, because remember the original protocol didn't even use them. So when we started out, we looked at everything that we could think of at the time. Excuse me, and I was using humic and fulvic acid in the beginning. In fact, I love the high concentration of nutrients in there as well. But as a binder, I didn't find it to be that strong. I know, based on a lot of research that I've done, that Zeolite is our go-to for just about everything. In fact, I've got my tub right here. So, but it is actually so powerful because of all the different mechanisms that it uses, like absorption, ion exchange, and all that. So when it comes to other ones, you're more than welcome to introduce those into your daily session. But I really try to keep this so that people have, pretty much a set program, and then from there, certain biohacks can be done. including adding like the humic and fulvic acid.
Yeah, and I'm also, because I am in Australia, just trying to source things. Some things I already have some, 100 milligram and 500 milligrams of niacin.
I do have some help for you on this because I just like Canada, I know how Australia is with being able to get certain supplements and things, the consumables as I call them, for the protocol. And I do have a list of available products to you. They've been sourced by other Australian clients of mine, and so I've got stuff for you.
Okay, well, maybe because I was going to, before scheduling the one-on-one, I was going to do all my preparation of reading up on all the documents
Well,
from
the reason
the
for
group.
the reason for the complimentary consultation is to help you get things sorted out prior to actually starting the protocol. If you're looking for protocol advice while on the program, that's a chargeable service. I've got a protocol advice retainer that people can buy. It's basically a $75 fee for 1 hour, billed in 15-minute increments. So if we get on a Zoom call and do 15 minutes, you still have 45 minutes remaining. But for pre-assessment of whether or not this protocol is right for you, and to answer questions prior to doing the protocol, that's what these initial consultations are for. So I just want to make that clear because you know, I do have to make a living off of my work. So.
Yeah, and yes, I certainly know about your coaching services as well. So to find out the information about Australian sources, is to how best do I
Well,
get that through the?
yeah, set up a complimentary consultation, and we'll be able to go through and make sure those products are the links are still good and all that. So I'm happy to work with you there.
Wonderful. All right. Thank you very much for your time.
My pleasure. My pleasure. Anybody else? We're coming up on 11:30 here, and so does anybody else want to throw in a last question?
Dan, it's Andrea once again.
Hi there.
Hi. Can you please share how I could set up a 30-minute consult?
Yes, in fact, I'll have on the screen of this video, it'll say heal.me/detox. So heal.me is the website, and then my custom link is /detox. It's not it's not my website, by the way. It is a booking service, and it does give me a little grief every once in a while because what will happen, and I want people to hear this, is that you'll see the available times in your time zone that are available on my time zone calendar. And then when you book the time, you'll get an email confirmation from heal.me that will be in Pacific Daylight Time. So keep that in mind. The date and time will be the one you selected, but you'll see it in my time zone in the confirmation. That annoys me. But and the other thing too is pay attention to the confirmation email, because it'll have the Zoom link and passcode, but the reminder doesn't seem to want to include the passcode. So that's another annoyance about it, but I'm sure we'll get that fixed here soon. It's a new service.
And I'm driving. Did you say that you were going to post that on the screen?
Yeah, when I have this video available, it'll be up on the screen. It'll say heal.me/.
Thank you. Thank you so much.
You're welcome. I look forward to having a one-on-one consult with you. All right, so shall we go ahead and wrap up the meeting for the day here, guys? Looks like everybody's good. Okay, well, thank you all for joining me, and we will be looking forward to meeting with you guys in a one-on-one consult.
Thanks a lot.
Thank you.
Okay, guys.
Thank you, Dan. See you.
Oh, thank you. Talk to y'all later.